Hi, I'm Tulokas from the University of Helsinki, and today I'm presenting our results on pregnancy and delivery after mid-urethral sling operations, which I'll call sling operations for short. During conducting the study, I have received grants from these three non-industry organizations. With this study, we try to figure out if pregnancy and delivery after sling operation affects the operation results. To answer this question, we conducted a retrospective case control study. As cases, we included women who had a pregnancy ending in delivery after a sling operation, and for controls, we selected women that did not have a pregnancy after their sling operation. The controls were matched with cases by age, operation type, and operation year, and we included up to 4 matched controls per case. To identify our sample, we combined 2 Finnish national healthcare registers. The care register includes all out- and inpatient visits in specialized medicine to all Finnish public healthcare institutes. In Finland, the public sector is predominant operator, and 98% of all urinary incontinence operations are reported to this register. Medical birth register includes all deliveries in Finland. From the care register, we identified women who had a sling operation, and from the medical birth register, we were able to check which women had a delivery after the operation. After identifying the case and control women, we excluded those who had hypospadia as the indication instead of urinary incontinence. If a case woman had an incontinence reoperation already before the subsequent pregnancy, they and their matched controls were excluded. Finally, we were left with 94 cases and 330 controls. We selected 3 procedures for stress urinary incontinence as our main outcome. We also reported new hospital visits for urinary incontinence and all visits for lower urinary tract symptoms, pain and sling complications during pregnancy and postpartum. The 3 procedures and visits were identified from the care register described previously, and also from a register for primary health care, which includes patient visits in public healthcare institutes in general medicine. Here we have the sample demographics. We did not match the groups for preoperative parity, and there were no more nulliparous women and multiparous women in the case group. We had a long follow-up time, over 10 years in median. The delivery mode after the sling operation was significantly more often by cesarean section than before the sling operation. However, we do not know the indications for the cesarean sections. New incontinence procedures were performed for 3 cases and 17 controls, and there was no difference between the 2 groups. We tested subsequent pregnancy, incontinence type, operation type, and parity as risk factors for an incontinence-free procedure by Cox regression analysis, and none of these tested factors were found significant. Around every 4th woman in both groups had a urinary incontinence revisit to a doctor. There was no difference in the rate of revisits, but the case women had their revisits significantly later than the control women. During the pregnancy and postpartum subsequent to the operation, 4 women had visits for urinary incontinence, 4 had urinary tract infections, and 12 had a visit for the pain in the abdomen, pelvis, or perineum. Unfortunately, we were not able to tell if these visits for pain were sling-related. There were no visits for urinary retention, dysuria, or other urinary tract symptoms. There were also no visits for a sling-specific complication. In conclusion, with this study, we did not find pregnancy after sling operation as a significant risk factor for a stress urinary incontinence reprocedure or revisit. This result is in line with previous studies. The number of visits for lower urinary tract symptoms and pain during pregnancy and postpartum was also low. We think that these results suggest that future pregnancy plans do not need to be considered as an absolute contraindication for sling operations. This concludes my presentation. Thank you all for your attention, and please stay safe.